Hey, everybody. Thanks for joining us today. My name is Ed Ricks, and here with a couple of colleagues of mine. We'll introduce ourselves in just a moment, but just want to make sure that everybody's on board here. Looks like everything's good from this end. So I'm going to move us forward a little bit. Just so you understand what it is that we're going to talk about today. I mean, we'll introduce ourselves briefly. I'll give you a little bit of who Baker Tilly is, and then we'll ask Rachel Stuckey, our guest star, to talk about Beacon Health a little bit, the healthcare institution that she comes from. Dave will talk about intelligent automation briefly, and then frankly, we'll spend the bulk of our time just in an open conversation. And please, if you have any questions to submit, please do it in real time along the way. If we can get to them when we see them, then we will. Otherwise, we'll try to leave a few minutes at the end to address any questions, but we look forward to any of those. And I'm looking forward to the discussion. This should be really good. And as I mentioned, my name's Ed Ricks. I'm Managing Director on our healthcare IT practice at Baker Tilly. I've been with this organization about 3 years, but the bulk of my experience has been 20 plus years as a CIO in hospital systems and a Chief Operating Officer. Dave.
Hey everybody, I'm David Hickey. I'm a principal at Baker Tilly's digital practice, and my focus is on intelligent automation. And back to Rachel.
Hi everyone, my name is Rachel Stuckey. I come to you from Beacon Health System, and I am a manager in IS over revenue cycle applications. We have Oracle Cerner as our revenue cycle, and intelligent automation. Glad to be here.
And the guest star of our show today, by the way. But just briefly, if you haven't heard much of Baker Tilly before, we've got a big story to tell, which just got bigger about 2 weeks ago. So Baker Tilly, through a merger with another very good organization, a couple weeks ago, we became now the 6th largest CPA advisory firm in the U.S., growing every day, over 11,000 team members on our group. I mean, I could go through a whole list of things here, but just so you know, we've got a large healthcare practice and we have a large healthcare IT practice. And this sort of brings all the best of all of those elements together, both our healthcare IT, our digital capabilities with RPA that work across different area industries, and then what we do with some of our clients and what you'll hear the stories today. So we'll go on from there, and Rachel.
Yeah, so Beacon Health System, if you're unfamiliar, is I like to say, a small but mighty healthcare system in northern Indiana in southwest Michigan. Our central office is located in South Bend, Indiana. For any of my Notre Dame fans out there, go Irish. We have 7 hospitals across our area, in addition to just shy of 100 ambulatory clinics. Over 8,000 associates, about 1,200 providers, and I'm excited to share a little bit about Beacon's intelligent automation program with you today.
Thanks, Rachel. David, you want to kick us off a little bit?
Yeah, absolutely. So at Baker Tilly, I'm in charge of the intelligent automation practice, and so we have customers who are in the finance, the insurance industry. We're heavy into government contracting as well as doing this for architectural engineering design firms, and of course healthcare. And the thing that really stands out about healthcare is the size and complexity of this particular market. And when you look at the spend in healthcare in 2025, the projected spend, it's $5 trillion. And just for reference, I looked up if healthcare were a country, where would they fall in the GDP, ranking? And that would actually put our healthcare system spend as the 3rd largest country in the world, behind China, which is just remarkable. And there are so many challenges associated with that spend, because it's such a nuanced and complex system that we're dealing with highly regulated and different buyers and payers, and it's just a very complex system for anybody to manage. And there's just a whole bunch of challenges associated with that. One of them being, right now, the workforce, especially in healthcare, there's a lot of pressure on the general workforce, where it's getting pretty intense and they're having pretty high turnover rates. But you add that on to the fact that right now there's a baby boomer retirement going on, where in the United States, we're actually losing 30,000 net workers a month, right? And these are experienced hires that are actually retiring now that the baby boomers have hit the halfway point. And so there's just a massive downward pressure on personnel across the board within healthcare. And of course, the complexity of healthcare in general, and Rachel's going to go in this in quite a bit of detail, but the rev cycle is so complex. And they estimate about 15% of every dollar goes uncollected right now within the healthcare system because of the complexities and in the overall process. And of course, the process is just getting a little bit more complex as the payers and providers are trying to figure out how to better provide services to their customers, and things like value-based care come online, which require a whole bunch of different paperwork as well. So large and complex system we're dealing with. So, one of the solutions we're here to talk about today specifically, in the outset, it said robotic process automation, but what I'm here to kind of talk about is it's actually evolved into something we call intelligent automation. And so about 8 years ago, when I first got into this technology, it was really just robotic process automation, or applying digital workers that could simulate your hands and your eyes. That's what we commonly call it. And so we could quickly build a robot that could do deterministic actions, so if-then statements, to quickly build processes that could handle high volume rules-based processes that your folks were doing today. And we could simulate this stuff very quickly, build these digital workers, and deploy this technology so that your people weren't just moving data around between applications and systems. And about 3 or 4 years ago, we started getting more advanced with some of the machine learning engines that could ingest, for instance, intelligent document processing technologies that could ingest any type of document, identify the type of document that it was seeing, and then based on that document type, scrape that information and normalize it for you. So that really kind of broadened the type of use cases you could start to use because of the amount of documentation in the healthcare world that was flowing into the system. For the first time, you could identify it, scrape that information, and normalize it. So then you could then process that information with robotic process automation. And of course, the latest trend, as everybody's quite aware of, is AI, and specifically with robotic process automation, there's something called agentic AI, or agents, large language models, to really expand the type of use cases that you're able to now simulate, because you're able to now not just use deterministic reasoning or if-then statements to determine what your actions are. You could actually use these large language models that understand context of data that's flowing into the system, written context, and can actually interpret what is coming in and then help take action based on business rules that you provide. And so this really opened up the aperture of the types of business processes that you can now link into your overall end-to-end automation processes, where maybe agents are taking on some part of the overall solution using their deterministic language model understanding of the content of the information that's coming in, and help make decisions for you. And then once that decision is made, hand that off to a robot who would then take action on the next steps within the overall process.
Thanks, Dave. I mean, so I'm so old that we used to call this scripting back in my day, but it's definitely gotten a lot better. As a purchaser of services, working in health systems all those years, I hated buzzwords that all the vendors use all the time. Now, I'm a vendor, but AI just always seemed like this buzzword that was being thrown out for the last 8 or 9 years. And you saw some early use cases that failed. And so finally, I think there are some things that are so practical. The technology is getting so good and yearly better every day. I think that there's a lot of opportunity for people. So we're kicking off a polling question here. We'll have 3 or 4 more of these, I think, as we go through, and just to gauge, what people are feeling and what they thought about and how they're thinking about the future. I think on that. And while you're filling out this poll question, and you'll be able to see results in real time when we do that, I'm going to start asking questions, I think, of Rachel and Dave, and just sort of start the discussion. Rachel, I'm going to start with you. Like, what inspired you guys at Beacon Health to adopt intelligent automation, and how did you just get started in the first place?
Yeah, thanks for asking. Here at Beacon, we started on the path of intelligent automation about a year and a half ago, so late 2023. Our first automation went live in June of 2024. So we're right at that year mark of having our first automation live. And the driving force behind, why we ultimately decided to pursue RPA at Beacon was the, increases in efficiency, accuracy, and compliance. Those are kind of the three words I think of when I think of what has automation done for us and what were we looking to get out of it. Automation can supply efficiency. As I mentioned, bots can work 24/7, whereas most humans do not. Bots are also very accurate. They're built to do, one task only if we're talking about RPA. And it does eliminate some of that natural human error from processes. Staffing, has been not an easy task over the past few years in the healthcare sector. And I can, happily say that we haven't gotten rid of any employees because we are building bots. But what we're doing is we're able to delegate some of those tasks that we're overloading our human workers, and that leads to less burnout, less turnover, and we have seen those benefits.
Yeah, I mean, that's practical, I think. So, Dave, when you talk to clients that are looking at doing something around RPA or some sort of intelligent automation, what factors should they consider before starting?
So I would always say make sure you nail down who your executive sponsors are, and make sure you understand all the different organizations within your firm that are going to be impacted by it, and get them involved. And especially your IT department. We've had a couple of projects where the functional guys were so excited to move forward, they kind of left the IT guys in the lurch until the very end, and that didn't go over very, very well. So make sure you get your IT guys involved from the get-go. RPA is not heavy on the IT installation. It's a pretty light install, but still, there is actions they have to take. I also I do recommend you do start small with this technology, and smaller and I guess simpler builds. Anytime you introduce a new technology, you can literally get an automation to these bots to do anything for you, but you can go a little bit too overboard with the complexity of it. And since you're just getting introduced to the technology, I recommend identify those, they call them the low-hanging fruit, simple automations that you can probably knock out in a month or so, 6 weeks, and get some quick wins on the board, and then get everybody familiar with the overall process on how you design, build, test, and deploy robots. So it's kind of get everybody on the same page. And then I would say focus on pipeline. It's all about pipeline with RPA, right? So build a robust pipeline of automations that you can line up all of the organizations and your advanced RPA developers that are going to be supporting those automations, and then finally make sure you capture the value of your builds. Some people forget that at the very end of the day, they got to make sure they show things, how much value they're deriving from this solution. And it's easy to do, right? Everything's transaction based, so make sure you're capturing the value by transaction so that you can track it real time. Those are probably the top 6 or 7 things I would recommend.
One tidbit in there is pick the right use cases first. I've got a friend who's got an AI company around virtual care, and his mantra all the time is pick the right use case. Like, there are 100 ways to make an improvement through a process, but pick the one that's giving you the best return, and whether that's going to be financial. And I think we'll talk about some of those ways so you can have it. And the example he always throws out there, this is a great one, is IBM. The early days of AI, they have Watson, and what do they try to do first in healthcare? Solve cancer. That's a brilliant thing to go after, but it's a little bit big, right? And automate the boring stuff that you should be automating first. So, Rachel, how do you guys pick what processes to go after, and has that sort of matured over the last few years while you've been working on this?
Oh, it definitely has. And this will just, reiterate what Dave was explaining, because it all comes down to a pipeline. We have at Beacon probably about 30 ideas. So these are brand new ideas coming across the entire health system that are waiting to go through the steps to get approved and deployed through our RPA pipeline process. And the key to our pipeline is having some stop signs or stop points along the way, where we can get a governance board involved. And I do see, Michaela, your question, came through. So this is a great time to bring that up as well. Is that at Beacon we have a governance board, and the purpose behind that governance board is to have the bottleneck really be at that governance approval portions. If you imagine 30 items coming through, they're going to hit governance, and once they're approved, we don't have a team of 20 plus developers that can put everything live, and we don't want to put everything live. The governance sorts which ones are priority, which automations we want to take live first over others. We look at what strategic goals we have for that year. We're in June, so about halfway through the year. What metrics at Beacon are we trying to enhance, and what ideas have come through that correlate well with those? We also look at which automations are in development currently. If we have 2 or 3 complex ideas that are being worked to get live right now, we're not going to take a 4th one. We're going to take a simpler one if we want to put another one in through the pipeline, just for time's sake. Those are some of the things that we do to ensure that we are selecting the proper ideas at the proper time. And it really comes down to a governance structure.
So can you share maybe one success story on an automation that had a significant impact in a process? And maybe it also would be good to say, like, where have they landed? I'll say departmentally at Beacon, is it all rev cycle? Is it other operations? And where maybe some of the pipeline looks like it's coming from?
Of course. So I'll kind of answer your second question first in terms of, what departments are impacted. At Beacon, any department across the healthcare system can submit an idea. Those in our pipeline currently, there's a lot in the patient accounting revenue cycle space, and a lot in the front end patient access space. We have gotten ideas from managed care, human resources, coding, even like supply chain, and some clinical ideas as well. The places where the volume is greatest is patient accounting and patient access. And I can think of one very successful use case that impacts both, and that is our good faith estimate automation, use case 64. And use case 64 was a compliance automation. So if you are familiar with the good faith estimate, it became a law just a few years ago, where we are required to submit a patient estimate, so an estimate of services for outpatient, within 72 hours of a patient scheduling their appointment. And this is only if patients are self-pay, and there is a penalty for the healthcare system, a fine, if that is not met. Well, we said, hey, can automation be a solution for this? And it sure has been. We have a very high success rate with this automation. And what it does is it looks out through a work queue in Oracle to see patients who have been scheduled recently. It goes into our patient estimate eligibility tool. It runs eligibility, makes sure that patient doesn't have insurance, that they're truly self-pay. It adds in proper CPT codes to then generate a patient estimate based upon the charge management that we have in place. And once it has that estimate, it actually takes another step and goes to our third-party application for communicating with patients and texts the estimate directly to the patient, which satisfies the law that states we have to supply the patient with an estimate within 72 hours. It's been a great story, RPA story, and again, it impacts patient access, but it also impacts the financial side as well.
Yeah, that's a great use case. We're going to put on Dave's list to solve cancer for you guys next year. I love those because a person was always doing that before. A person could still do that, and maybe in some cases it still does. But there's so many different things they have to do, and then you look at the time, the propensity to make a mistake or an error or something, and you're taking them away from other things they could do that could drive user experience. I love that. So, like, based on that one and some of the others you've done, how do you measure, the ROI, and do you try to measure ROI for everything? What's that mean? And then Dave, I'm going to ask you the same question. I think for other clients, how do they show success and drive that?
That's a great question. I think it's extremely important to have an idea of how you're going to capture the bot's success prior to implementing it. That is part of what the governance board looks at. We have a tool built into our automation platform that helps us determine expected ROI. Values that are plugged into that model are things like, how much manual time does it take a human to do this work? How much does the human work per week? How much do they make? And what's the volume of transactions? Are we looking at, 50 a day, 1,000 a month, or more? We take that number, we in the calculator are given a value of how many hours could be saved if this is implemented, how many dollars per year could be saved if this is implemented. And again, that's all before we even start. So we have a baseline, we have something to work with. And then once the automation is live, we actually do monthly checks at our governance meeting to determine if those metrics are being met. We spend a lot of time looking at the hours saved metric to ensure that our automations are, running successfully, minimal errors, and that does translate to a financial savings.
Yeah, and one thing I would add in there is, and Rachel already mentioned this, these bots, they run 24/7, and all they want to do is process transactions. And the big difference between them and humans is that's not what is on the humans' priority list, right? Humans can't sit in front of a computer and process transactions 24/7. You can't physically do it. And so a lot of times when you initially sit down and you say, okay, well, this process takes 10 minutes, and then you start doing the math based on transactions, you come up with a number. That number is usually grossly understated for the actual value, right? It's actually going to save you and personnel and how many people it would take to actually perform that task, right? Because the math might say 5 people, but you might actually have 10 or 12 people doing the task, and that's the reason. Because humans are in meetings, or they're on lunch breaks, or there's other things going on in the office, process improvement initiatives, and you're just thinking, oh well, this person's supposed to do these transactions, and you assume they can do it 8 hours a day. They just can't, right? It's just not possible. So that's one thing you want to consider as well. There are the one kind of great thing about RPA is it does, if it's built correctly, every transaction gets queued up individually, and you can track every single transaction, and every transaction can be linked to a savings, and then that can be tracked real time. But there are other benefits that can be derived as well. We had one client who we showed significant cost savings over time, and this was on the AR side, receivable side, and they're like, that's all well and good, but if you shrink my days of sale outstanding, right, how long it takes me to get paid by my vendors by 1 day, I saved $30 million in interest, right? And so that was something that wasn't transactionally being set or monitored by the bot, but they were monitoring their DSO days and how our process improved that by 2 or 3 days. That made a huge impact for the organization. We've also had some customers who came up to us and said, hey, the ROI isn't necessarily there. Our biggest concern is limiting the access to critical or sensitive data. And in some cases, they just wanted robots who are given very explicit, deterministic instructions on how to handle this data to manage the data, so they could really reduce the pool of people who had access to it. And that was their priority. And so that to them was not measured in hours saved, that was measured in risk mitigation.
I like that. The question I was going to try to get to later, but I think is a perfect time now is, some people are concerned with privacy and security of data and letting the bots take over, that kind of stuff. I'd love to know, I'd love to hear how you address that with a client, David, first, but then Rachel, what's that discussion look like at Beacon, I guess, after his response?
Well, it's very interesting because there is a trust layer within the application, right? And the automations just do what you train them to do. And you go through a very formal design, build, test phase, so you understand exactly what these automations are doing and not doing, right? They don't go rogue on you when you have a very deterministic model. Things get a little bit more interesting when you start to work with agentic automations. And so you want to make sure you put in very strict barriers on what they're authorized to do, because they are acting more autonomously in their roles. So you want to have very strict and defined rules and test those automations to make sure they're acting properly within those defined roles. But from a data security standpoint, I mean, these automations are being used in healthcare, finance, banking, insurance. The data is locked down in a trust layer. And once you design and build and deploy a robot, if you try to mess with the robot that's in production, it will break, right? And so it's just doing what you're authorizing it to do, which, like I said, for some of our customers was the primary reason. And Rachel, I don't know if you had anything to add to that.
I do, and at Beacon, we right off the bat, made it exciting. All of the opportunities that this is going to lead. Yes, it is natural to be a little hesitant, and for some people to have differing views and differing opinions about RPA in their workplace, and that's okay. And so what we did was bring this up as many presentations in forums, leadership calls, and really make it exciting. Show what the potential would bring to Beacon. And once we had live automations, we would not just talk about RPA, we could show them proof, about the ROI, the ROE, success stories, that it is working and that you can trust it. RPA is, I'll say relatively, because everything can't be entirely safe, but it's safe. I'm happy and comfortable saying that, because it's a one-to-one. It's you're building a automation to do if-then statements. If it sees this field in the exact landscape, it's going to do this exact task every single time. If something is slightly out of place, it's not going to complete the transaction. We have those safety measures in place too. We go through a lot of testing, a lot of approvals. It's a big change control process. And if you follow the right steps in the right order, bots can be very trusting, and it's just delivering that information to your staff and to your organization so that they can trust it as well.
Yeah, it's hard to punish a bot, and you've got to train them very mechanically. I'll ask this question, but I see someone submitted one from the attendees that's really similar. Like, when you find an error that's happening with a bot, how do you fix it? How do you resolve it? How do you address it? And I know some of that stuff can change with agentic and what that looks like, and we'll get to that in a few minutes too.
Yeah, I'd be happy to answer that if you'd like me to.
I'd love to hear in the real world, yes.
Yeah. So bots do break. bots have errors, and it's just routine maintenance. It's part of making sure that everything is running appropriately, looking at dashboards, graphs, tables that we have built directly into our platform that give us alerts when something goes awry. An example of something that could go awry is provider portal password expirations. We have some automations that use things like Availity, United Healthcare, Indiana Medicaid, and those passwords naturally expire. When they expire, the automation's unable to log in. Therefore, every transaction is going to fail until you, replace that password. Good thing is we have alerts in place. We have mechanisms so that we are notified when that happens. We go and change the password, update the automation, and voila, it runs just fine again. Easy things like network issues. Sometimes the bot has a difficult time connecting to the VM or the virtual machine, and that's okay. Usually network issues will resolve themselves, or they need minor intervention, and that would be something we would get an alert on, and we'd go and fix it. Of course, the big thing to remember is communication. I stress this, anyone who's looking into automation, please communicate very clearly and often with your process owners and SMEs. Those who work in the department that the automation, lives in. It's very important to be open, honest, transparent, and upfront about errors and when the bots were running and when they were not, in real time. And the reason is a lot of instances at Beacon, we actually have, as I mentioned prior, we've redelegated some of that work away from humans that the bots are now doing. And if the bot is struggling and maybe it's going to be down for 24 hours, then a human most likely needs to come in and do that work in its place while it's down. It's just like an employee being sick for the day. That's something that we didn't know right away, didn't think of until we were live. So now we've built in, very standardized email communication to help mitigate that.
So what Rachel just kind of reviewed was there's business rule exceptions. Those are known business rules that when a robot hits, it's designed to shoot off an exception. It's sort of like, hey, I'm not authorized to manage this part of the process. I need a human to interact, right? So it's a long running workflow with a human in the loop. And those are business rule exceptions that are designed in the system based on whatever, standard operating procedures you have at your facility. And then there's system exceptions, again, like internet went down and a process didn't kick off or a password changed, right? And so those are system exceptions. You also have cases where a data condition that never thought of before occurred, right? And it caused a hiccup in the automation, and that would kick off an exception as well. And that's when you'd have to get your managed service guys to come in and take a look and say, okay, how do I modify the automation to account for this new data condition? And so you would go through the formal, design, test, validation, and deployment of that change as in order to address a data condition it hadn't seen before. You also have cases with when you're dealing with machine learning, for instance, the intelligent document processing, when it's scraping information, the automation can give you a confidence level that it's grabbing the data correctly. And a lot of times, it doesn't have any issues grabbing data from PDF files and everything looks good. But sometimes, these are not native PDFs, they're scanned documents, and maybe somebody put a stamp on it somewhere or wrote on a document and got scanned. And so it didn't necessarily grab a piece of data correctly. And so it actually will let you know, hey, my confidence level wasn't particularly high, and it'll shoot it off as an exception to a human to take a look at just to do the validation.
That makes sense. I'm going to jump to our next poll question right now for folks and see who's still staying awake while we talk about it. I'm enjoying it no matter what. So if we can kick off that poll, please, Lynn, I think that'd be great. And then we'll go to another question while people are filling that in, but I love seeing these answers.
Yeah, I know, yeah.
Yeah. can do that. Let's see. All right, I'm going to do one more around sort of process and what we're doing today and technical stuff, and then we'll jump to future things for the last little bit here. Like Rachel, have there been any challenges with like integration with your EHR? I mean, what's been the biggest, I'll say, technical concern that you've had with automation? And you know, I hear you loud and clear, and I think that the more use cases you employ, the more different things you touch, whether it's, you know, a payer portal or your EHR or a patient list, you know, to send the text or whatever. But what were like the technology concerns you've had on that front?
Yeah, great question. There have been a few technology concerns, and I will kind of think through them as I'm, you know, answering the question. So, because I can think of many, I just want to, you know, obviously make it concise. And it's not that I'm thinking of many because, you know, it's you know, scary or impossible, or, you know, we're coming up with issues all the time. It's just we put live 15 automations within a 6-month period. So we kind of unraveled a lot at one time. So one of the things that we came across with is ideas being submitted. And once you dive into a requirements gathering call to really, you know, get the details of the automation idea and the workflow process, we're finding that RPA isn't potentially the best solution. An example that I can think of is any automation in the clinical space that leads to having to look at a non-discrete field. So I think of a discrete field, something like height, weight. Non-discrete would be the H&P or the chief complaint. It's free text, and RPA is not great in the Oracle, you know, Cerner PowerChart platform at reading the H&P or reading that chief complaint and then putting into action what the next step of the workflow is. So if we're unable to create a discrete field or a user-defined field, a UDF, then that is a barrier to putting that particular automation live. You know, something else that we've come across is payer portals. I know that's not our EMR or EHR platform, but you know, payer portals can change. Any application from any vendor that's not, you know, your own. You know, we at Beacon control our version of Cerner. We do not control a third-party application or, you know, a payer portal website. And when they make changes to their applications, it does impact our automations. Because again, those discrete fields, the selectors on the screen, the way that the website page looks is different, and automations don't know how to, you know, change over time without human intervention. I can think of one more like direct impact to our, you know, EMR or, you know, barrier. Sure. I would say work lists. The bot needs a task list, you know, to start its day off with, and some of the work queues and work lists, you know, take a long time to load, and that load time, you know, sometimes does impact automations, and then you just have to find ways around that, you know, creating smaller work lists, loading it at particular times of the day, and just being a little creative.
That's great. Dave, anything to add to that? And while you're talking, I'm going to go ahead and advance us and ask for the next poll question.
I think the thing that's kind of neat about intelligent automation is it's filling the gap between applications and systems. Most large organizations, I think the latest poll had something like organizations have like 120 enterprise applications, and very few of them talk together, you know. And so the cool thing about RPA is it can literally mimic anything you do on a computer screen. So it's really versatile. So, you know, some of the concerns you might have would be, you know, system access, you know, like is the bot authorized to log into an application or system? Not can the bot, interact with that application or system. The bots can kick off APIs. They can work at the user interface level. It's so versatile that's kind of its superpower, right? It's filling in the gaps for all of the problems they have between these applications and systems and these long running workflows that go across numerous different systems. I can also say that some of the things that, technology is changing so fast. So the use case that Rachel just brought up is starting to be addressed by the agentic AI. Right now, we can read and interpret context and make decisions based on that. And they're even building automations that are self-healing as well, right? So if something were to change on a page, right, a third-party payer, and they change their website, and all of a sudden a field moves, or they added a different field, there are ways to actually have the automation recognize that, and in a self-healing move actually correct itself and make the adjustment on the fly and keep going. So, that's just the speed of change that is occurring in this technology realm. It's moving very fast, and it's trying to fill in all the issues that we're currently having that are, I guess, causing some of the exceptions that we're currently managing today. So, as these new technologies get introduced today, you start to project out, where's this going to be in 3 to 5 years, right? At the pace it's going. So it is a fun technology to work with because of its versatility and how quickly things are adapting and changing with it.
All right. So you didn't mean to, but you led me right to my next question. And first of all, I love the self-healing. It sounds like therapy for the bot.
That's right. Couch involved.
You do that with a glass of wine, or So, all right, Dave. Let's shift a little. For both of you, but David, what do you see, just technologically speaking? What's the trends in intelligent automation? And I guess I know you work in a lot of industries, but so specifically to healthcare, what do you think is going to have it be impacted in the next year?
Yeah.
Well, this is available now, but year 2, 3, 5, what's it look like?
Yeah, 100% is the agentic stuff is just going to come on so fast and so strong. It is a relatively new technology. I know there's a lot of marketing out there to make it seem like it's been around for 10 years. It has not. But it is pretty remarkable what these language models can do. I'm sure everybody on this call has, played around with, ChatGPT or one of the other language models or generative tools that are out there that are either taking context or images and generating output. It is a remarkable technology, and what some of the vendors are doing right now is harnessing that technology, right? And so they're building what we would call like a prompt engine that would allow you to build a persona. It's almost like a job category, and so you would define a very specific, discrete task you want automation to perform, and then you would build the prompts to define what their job is and the things they can always and never do, right? So you build the boundaries, and you build that into this prompt engine that's permanent. It stays there, and every time the system gets prompted, it would go back to its prompt engine to say, okay, this is how I'm responsible for acting, and so. And of course, you can adjust it over time, right? So you build those boundaries, and if there's a data condition that violates one of those boundaries, that's what would shoot off an exception to a human to manage. And if the person looks at that data condition and says, you know what, we should be able to handle this too, and here's the business rule, you would feed that back into the prompt engine, and that would be another one of its business rules that it would then start to manage for you. So it's pretty remarkable. So you build the prompt engine, you define their job or their role, and then you give it what we call context grounding. So this is the data underlying that role that they're allowed to access in order to perform the tasks, right? And so that could be standard operating procedures, it could be regulatory requirements, it could be databases, right? Tables, that you'd actually define all the different elements. You define how they're going to interact with those elements as well. So here's your job and here's all the resources and data you have to answer the job to provide the context for your responses. So that's really where everything's going, and it's completely changing the game, and really opening up the types of use cases that you're now can manage with intelligent automation. It's pretty exciting stuff.
Yeah, no, I love that. I mean, I like that piece of it. I think it speaks to what Rachel was talking about a few minutes ago, when you can understand height and weight because it's discrete data, but when you get into a full H&P or whatever that's been transcribed or something, how can you work through that? So, Rachel, what does agentic automation mean to you guys at Beacon, and what are you kind of excited about?
Yeah, at Beacon, we are very much, looking into the possibilities of what agentic AI and, adding agents to what we do now and what we could do in the future. It is, as Dave mentioned, it's hot off the press. It's new and it is exciting. I can think of one idea in particular that we have had to, decommission, or decline, because we could not achieve it with RPA. We went through, several week process of going through the workflow and trying to figure out a solution that the API, that I said API, I meant RPA could help with. And I think agentic AI may be the key, and that is around submitting authorizations for services in provider portals. We do have 2 automations today that look out on portals to see if an approved authorization exists. But the barriers that we came across with actually submitting the authorizations was that there were some gray area questions. Everything was not black and white, like what's the patient's name, date of birth, date of service, diagnosis, things like that. The gray questions are more like, has patient had physical therapy for their left leg injury in the past 3 months? That is something that requires, an automation or a human to go into the record to find the answer, and it isn't discrete and it's not black and white. And I believe that, an agentic AI could help with that. So the possibilities are exciting of where this can allow Beacon to grow in the near future.
I mean, those are great use cases, and I can definitely see that working out over time. One thing I probably should have asked you earlier, and we still definitely have time for this, is what has it done to your technical staffing to be able to accommodate this from an engineering perspective, maintenance, how do you support? And Dave, then after Rachel talks, maybe you could explain, ways that you've seen us be helpful to clients in that space.
Yeah, I'll start at the beginning. So, at the beginning, we put 15 automations live. Like I said, the go live dates were a span of 6 months, but it really was 1 year of development to go live of our last. And we did this, through the help of a consulting company, because we were brand new. We didn't have the staffing, the structure, the department laid out, but it allowed us that year time to develop it. So currently, we have an intelligent automation department that sits under IS, and that was a new department when we decided to take up RPA. I do think it was beneficial that we pulled it into its own, because it is a full-time job for everyone on board. It's nothing that I could imagine somebody doing in addition to the other IT-based role that they have. It's really an all hands on deck. So the types of roles that we have here at Beacon are RPA developer roles that actually build the bot code. We have a solution architect that oversees the developers and does a little bit more of the stabilization optimization work. And we have 2 business analysts who help coordinate the requirements gathering calls, direct communication with the process owners, and ensure that a very clear and concise process definition document, or PDD, is created. Kind of like your blueprint for automations is what that business analyst role does. So we have 5 people on my team supporting now 16 live automations, with 4 actively in development and a pipeline of 30, and then 1 manager. And we have been stretched. I can't say we need 1 more developer, but it would be nice to have an extra developer on support. We do have particular developers who work new implementations, and different developers that work support. And sometimes you just naturally, your support tickets come through a little bit higher volume than others. But we're happy with a team of 5 right now.
And I know, and I'm not going to put you on the spot for any financial information, but I know you guys are measuring everything, right? So someone's saying, okay, you've created a new department with 3 or 4 or 5 people, and you're getting X amount of work done. We feel comfortable that there's a financial return to cover that plus. Is that true?
Yeah, that is true. Without getting into numbers, we have definitely in our first year, we have seen a gain, quite a steep gain in overall revenue, taking into account staffing, contracts, et cetera, like all of the whole balance sheet. we have seen a net gain, which is great.
Which is the number one thing everybody asks about, what is the ROI, or is there an ROI that's believable? It's not something imputed from us when we talk to them, and same thing, I hated that too when I was a purchaser. So I love people hearing that it's real. Dave, what other ways have you helped other clients sort of with their managing their staffing and things?
Yeah, I mean, so it's really important. So, if you listen to some of the vendors out there who implement the technology, we do a lot of work with particularly with UiPath, but even they're guilty of it a little bit. They make it sound like it's so easy to build an automation, right? They're the very first conference I ever went to 8 years ago. You would have thought you could have handed an iPad to a 2-year-old and they would be building automations and bots. There is a right way to build automations, and you can, if you do it right from the get-go, you build these enterprise automations. They call it the robotic operating framework, and you can ensure that the exceptions are managed gracefully, and that the coding standards are monitored, right? So you actually develop coding standards, you develop documentation standards. If you do all those little things up front and you do it correctly, then it becomes much easier to maintain the automations in the long run, right? And so, this is all we do. And so we like to go in and start helping our clients by setting them up from the get, right? This is how you do it. And this is how you do it so you can maintain it long term. And so we have some clients that, that's the role they want us to play. Come in, show us how, and get us going. And then we're going to, bring in our own. We want to make this one of our sort of a core capability of our organization. And they start either doing the managed application part of it, so they're maintaining the automations, or they're building the automations, right? Or maybe they're doing both. But so it's important to go up and make sure you have a company who's been doing this for a long time and has all those attributes to help you start off correctly. And then, there's this whole automation operating model that you can deploy as well. And Rachel alluded to it, like they have a center of excellence, but it's kind of bigger than just having a COE. What's the governance model? What is your change control process? What's your how do you manage the pipeline? What are the code standards? What are the documentation standards? Like all those little things are all in this automation operating model that should evolve with you over time, right? Like you have to have all that stuff in place when you first start and you roll out your first 4 automations. But when you start to get up to like 10 to 15 automations, you're going to want to grow that program and have a centralized organization who's managing not only the code and development of the code, but the marketing and of this within the organization, right? And the person who's shepherding those change control processes and getting it through the pipes. That's all very, very important as well. I'd also say you got to make sure you budget for things and make sure that this is accounted for within your overall budget, so you can plan and make sure that whatever your pipeline can be addressed at proper time. Some things that really frustrate organizations is they have a huge pipeline and they can never get to the builds, right? Because they didn't properly budget for it. And that really frustrates people because they want this technology. Another kind of thing that we've seen kind of stall organizations is they just treat the RPA group as just a line item expense, right? An operating expense. And they don't put any type of chargeback model in place. So what I mean by that is all of these automations that have been built and that are being maintained on an annual basis, we recommend you charge the organization some dollars to maintain and support it. And then every single build that you're pushing forward also gets charged back to that organization, because they're the ones seeing the benefit long term, right? They're the ones that are saving time and money. And so there's organizations that just didn't do that properly. And so their automations tend to grow to the point where they can't keep up and maintain the automations. And then even there are people who are like forward deployed to build new automations, they end up getting pulled back just doing maintenance and support. And so you have that balance there.
Yeah, I'm sorry. I think it's like the governance that Rachel talked about earlier really leads into that. Set that up strong at the beginning, and that helps drive that. And whether you actually charge back or not, and people have done that over the years, often on different ways in healthcare, at least you're showing the value of what you're doing and always monitoring that.
Well, we've definitely seen automations that were built at one point that if you charged even a nominal amount, the organization would say, well, no, I don't see the value in it. Right. Yeah. Shut it down. And that's great, right? If it's not showing value, shut it down. But just don't keep it going because, if something's free, then they'll just say, oh, yeah, keep it going. But then there's a maintenance cost.
All right, last poll question. We're down to the last minute. So I'm going to throw that question out, and I want to leave with Rachel. So I should have warned you about this, but like one tidbit or something, like what advice would you give to any organization that's thinking about getting into intelligent automation?
Great question. I would say that you cannot go wrong by giving it a shot. It is scary, it is the new world that we live in, but I'm very happy, that Beacon took the jump. I'm very involved in the work that my team does, and I see an impact every single day. So if I could give advice, it would be take the leap. You're not going to regret it.
And if all things go south on that, you can go to do some self-healing or something. Maybe Rachel, we can't thank you enough for joining us. I really appreciate it. I mean, great advice, a great story. David, obviously, thank you for the understanding of the environment, what it takes, and what the future looks like. I think it's really cool stuff. And with that, I will say thank you to everyone who joined us today. We really appreciate your time.
Thanks for having me.
All right, thank you.